Hello everyone. Today, our topic of discussion is a medication known as Reglan, whose generic name is Metoclopramide. As always, this conversation is intended for informational purposes only. Should you have any health-related concerns or inquiries, please consult a medical professional. Description: Reglan, or Metoclopramide, is an oral medication that primarily works by increasing the movements or contractions of the stomach and intestines. It's frequently prescribed for individuals with gastroesophageal reflux disease, GERD, who haven't responded to other treatments. Additionally, it's used to treat slow gastric emptying in people with diabetes, a condition that can cause nausea, vomiting, heartburn, loss of appetite, and feeling of fullness lasting long after meals. It's vital to note that using metoclopramide over extended periods, beyond 12 weeks, is not recommended due to the risk of serious side effects. Warnings: Reglan comes with several warnings. It should not be used by anyone who has had stomach or intestinal problems such as a blockage, bleeding, or perforation, hole. It's also not recommended for those with epilepsy or other seizure disorders, an adrenal gland tumor, or if you've ever had muscle movement problems after using metoclopramide. Before taking this medicine, it's crucial to share your complete medical history with your healthcare provider before starting Reglan. Inform them if you have liver or kidney disease, congestive heart failure, high blood pressure, diabetes, Parkinson's disease, or a history of depression. Pregnant or breastfeeding mothers should discuss the potential risks and benefits of using Reglan with their healthcare provider. Regular monitoring might be necessary for those with conditions that might be affected by the drug. Side effects: Reglan, like all medications, has potential side effects. Some people may experience uncontrollable movements of the arms, legs, eyes, face, head, or neck. If you observe these symptoms, contact your doctor immediately. Other potential side effects include feelings of anxiety, agitation, jitteriness, insomnia, depression, and tiredness. Reglan might also lead to tardive dyskinesia, a disorder that involves involuntary movements, especially of the lower face. This condition might not be reversible, even after stopping the medication. If you experience any unusual symptoms or those mentioned above, reach out to your doctor promptly. Interactions: Metoclopramide can interact with other medications. Always inform your healthcare provider about all other drugs you're currently taking, including over-the-counter medications, vitamins, and herbal supplements, to prevent potential harmful interactions. Dosage: Adherence to the correct dosage is essential for the medication's effectiveness. Always follow your doctor's recommendations when taking Reglan. It's usually taken 30 minutes before meals and at bedtime. Your dose and duration will depend on your specific condition and how you respond to the treatment. Do not take this medicine for longer than 12 weeks unless your doctor advises you to. Avoid: While on Reglan, avoid drinking alcohol as it can amplify certain side effects. It's also recommended to avoid operating heavy machinery or driving until you know how the medication affects you, as it can impair your thinking and reactions. FAQ: A common question is about the long-term use of Reglan. It's emphasized that prolonged usage, especially beyond 12 weeks, is generally not recommended due to the risk of developing tardive dyskinesia, a condition with potentially irreversible symptoms. Closing: That concludes our comprehensive review of Reglan. It's vital to remember that this information is meant to provide a general overview and should never replace the guidance of a medical professional. For any specific questions or concerns related to this or any medication, consult with a healthcare provider. Thank you for joining us today.